So today we are going to discuss about hypertension and its ill effect and mortality and morbidity regarding uncontrolled hypertension. So before we go into the pathogenesis of it, first we discuss a bit of physiological basis of hypertension. So our today's discussion will be on what high blood pressure is and how to prevent it. Now, generally, everyone like to have a healthy or a normal blood pressure, but what exactly does it mean? Basically, each time when a heart beats, it pumps blood into the blood vessel. This creates a pressure against the wall of the blood vessels. This is called blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle, for example, not having enough regular physical activity, obesity, smoking, alcohol consumption, and stress. So, there are other risk factors that can also increase the risk of developing hypertension. Firstly, age. As people get older, the arteries stiffen up and narrow as excess fat builds up. Family history of blood pressure. One or more close family members with hypertension increases person's risk of developing the condition. Excess salt intake is also known to raise blood pressure. Not eating enough food with potassium can increase blood pressure and risk of stroke and chronic kidney disease. Eating processed and fatty food increases fat throughout the body and makes heart work harder to push blood through the body, hence causing pressure to rise. Another one is stress. Reacting to stress in unhealthy way and not managing stress can also increase the blood pressure. So moving on to hypertension. Hypertension does not have any obvious signs, so it is also known as a silent killer. It puts people at the risk of several diseases from cardiovascular problems, kidney ailments, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring BP is the only way to know whether a person have high BP or not. Generally, when the symptoms do occur, they include morning headaches or tiredness, vision changes, blood buzzing in the ears, fatigue, nausea, and vomiting. If the person is experiencing some of these symptoms, then one should get their BP checked. Fortunately, high BP can be easily diagnosed. It is usually measured with the instrument called sphygmomanometer. BP is reported into two numbers, systolic and diastolic. So, what does this mean? A healthy normal blood pressure should be lower than 120/80, or it can also be read as 120/80. Here, the upper number indicates systolic, which means the blood pressure when the heart contracts, where the lower number indicates diastolic, means the pressure in which blood vessels when the heart rests between beats. If the BP is more than 140/90, then the person is said to have hypertension, and hence risk of developing serious heart disease. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to 1 billion people living with high BP worldwide. The theme of this year's World Hypertension Day is measure your blood pressure and control it, live longer. Ensure that the BP is measured and controlled if it is elevated. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, regular exercise, healthy diet, with smoking and alcohol intake, regular BP monitoring, stress management, adherence to medicine. If BP successfully, if the BP is successfully controlled with such lifestyle modification, then it might avoid delay or reduce the need for medications. So, what are the strategies? Regular exercise or physical activity. Exercise can be a drug-free approach of lowering BP. If one has a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on blood vessels will decrease and lowers the BP. In other case, we are all aware that age and weight gain are the two major risk factors for BP. So if blood pressure is at a desirable level, that is less than 120/80, then exercise can help prevent it from rising as you age. Regular exercise also helps you maintain a healthy weight, which, in my opinion, is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High BP level can be reduced by doing regular structured exercise such as brisk walking, jogging, and swimming. Healthy diet. Diet plays an important role, as mentioned earlier, for lowering blood pressure or preventing hypertension through dietary intervention. One can adopt DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and avoiding alcohol consumption. Now, DASH diet, DASH stands for dietary approach to stop hypertension. Usually, it is rich in whole grains, fruits, vegetables, low-fat dairy product, and skims. All saturated fat and cholesterol can lower one's blood pressure up by 11 millimeter of Hg if having high BP. Reduce sodium in your diet. Even a small reduction in sodium in the diet can improve the heart health and reduce BP by 5 to 6. If you have high BP, to decrease sodium in your diet, you can consider the tips like eat food levels if possible, choose low sodium alternatives of the food, eat fewer processed food, only a small amount of sodium, focus naturally in foods. Don't add salt, just 1 level teaspoon of salt has 2300 milligram of sodium. Avoid adding salt to food. Use herbs or spices to add flavor to your food. Stop smoking. Helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk for heart disease and improve your overall health. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctor and check up their blood pressure. Hence, most often I advise patients self-monitoring of BP. Self-monitoring helps a person to measure BP at different times throughout the day over a longer period of time. It also assists doctor to get more complete picture of the person's blood pressure reading at different times. Further helps us in better prediction of cardiovascular morbidity and mortality rather than a single routine blood pressure measure that occurs during a clinic visit. Stress management. By learning how to relax and manage stress can improve emotional, physical health and reverse BP. Stress management techniques include exercise, listening to music, focusing on something calm or peaceful, and meditating. Adherence to medicines. Medicine to lower blood pressure can be recommended by doctor if your BP is consistently high, usually at or above 140/90. Adhere to medicine is very important as it controls your BP regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us enjoy long and healthy life. High BP can be prevented as well as controlled in many ways. Keeping BP in normal range is very important in preventing cardiovascular complication. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.